Hi, welcome to Professor Dr. MMP's lectures. We will discuss the pediatric lectures of NEET PG multiple choice questions. Let's discuss.
Pediatrics MCQs for NEET PG with explanations. Here are some sample Pediatrics MCQs for NEET PG with explanations. Remember to practice more questions and review the concepts to improve your understanding. MCQ 1. A. 2-year-old child presents with recurrent wheezing, cough, and difficulty breathing. The most likely diagnosis is A. Cystic fibrosis, B. Asthma, C. Pneumonia, D. Congenital heart disease. Explanation. Asthma is the most common cause of recurrent wheezing in children. Cystic fibrosis usually presents with other symptoms like salty-tasting sweat and recurrent infections. Pneumonia is typically associated with fever and decreased breath sounds. Congenital heart disease often presents with cyanosis or heart murmurs. MCQ 2. A newborn infant has jaundice on the second day of life. The most likely cause is A. Physiological jaundice, B. Breast milk jaundice, C. Hemolytic disease of the newborn, D. Biliary atresia. Explanation. Physiological jaundice is the most common cause of jaundice in newborns and usually appears on the second or third day of life. Breast milk jaundice is a less common cause and typically appears after the first week of life. Hemolytic disease of the newborn is usually associated with maternal fetal blood group incompatibility. Biliary atresia is a rare condition that presents with jaundice from birth. MCQ 3. A child with fever, rash, and joint pain is most likely to have A. Measles, B. Rubella, C. Chickenpox, D. Kawasaki disease. Explanation. Kawasaki disease is characterized by fever, rash, joint pain, and other symptoms. Measles, rubella, and chickenpox also present with rashes, but they typically have different symptom patterns. MCQ 4. A child with recurrent infections, delayed growth, and a history of pancreatic insufficiency is most likely to have A. Cystic fibrosis, B. Celiac disease, C. Crohn's disease, D. Chronic granulomatous disease. Explanation. Cystic fibrosis is a genetic disorder that causes thick mucus to build up in the lungs, pancreas, and other organs. This can lead to recurrent infections, delayed growth, and pancreatic insufficiency. Celiac disease is an autoimmune disorder that affects the small intestine. Crohn's disease is an inflammatory bowel disease that can cause abdominal pain, diarrhea, and weight loss. Chronic granulomatous disease is a primary immunodeficiency disorder that affects the immune system's ability to fight off infections. Note, these are just a few examples. For a more comprehensive preparation, practice with various MCQs covering different topics in pediatrics.